Understanding syphilis, a common yet treatable infection. Syphilis is a sexually transmitted infection, or STI. It can be cured, but if not treated, it can be very serious. Syphilis is caused by bacteria. The bacteria are called Treponema pallidum. You get syphilis from direct contact. It happens during vaginal, anal, or oral sex. The bacteria enter your body through sores. These sores may be small and painless. You may not even notice them. Syphilis doesn't spread through casual contact. This means you can't get it from sharing utensils or toilets. You also can't get it from hugging or holding hands. It's important to remember that anyone can get syphilis. It doesn't discriminate, but with proper treatment, you can get rid of it. Early detection and treatment are crucial. If you suspect you might have syphilis, it's important to get tested as soon as possible. Testing is simple and can be done at your doctor's office or a local clinic. The sooner you know, the sooner you can start treatment. Treatment usually involves antibiotics, which are very effective. It's also important to inform your sexual partners so they can get tested and treated if necessary. This helps prevent the spread of the infection. Remember, syphilis can have serious health consequences if left untreated. It can affect your heart, brain, and other organs. But with early detection and proper care, you can avoid these complications. Regular checkups and practicing safe sex are key to preventing syphilis and other STIs. Using condoms and having open conversations with your partners about sexual health can make a big difference. Educating yourself and others about syphilis is also important. The more people know, the better they can protect themselves and their loved ones. So take charge of your health. Get informed, get tested, and get treated if needed. Syphilis is common, but with the right steps, it is entirely treatable. By taking these actions, you can protect yourself and others from this infection. Remember, your health is in your hands. Stay informed, stay safe, and take care of your sexual health. Together, we can reduce the spread of syphilis and ensure a healthier future for everyone. It's important to remember that anyone can get syphilis. It doesn't discriminate. But with proper treatment, you can get rid of it. So take the necessary steps to protect yourself and your loved ones. Your health and well-being are worth it. The journey of syphilis. Unveiling the 4 stages. Syphilis progresses through 4 distinct stages, each with its own set of symptoms and challenges. Understanding these stages is crucial for early detection and effective treatment. Each stage has unique symptoms that can vary in intensity and appearance. Knowing the stages helps with early detection and treatment. First, the primary stage. A painless sore appears, often unnoticed because it doesn't cause discomfort. This sore, known as a chancre, typically appears at the site of infection, such as the genitals, rectum, or mouth. It may go unnoticed and heal on its own, but the infection remains in the body. Next, the secondary stage. A rash develops, often on the palms of the hands or the soles of the feet. During this stage you might feel sick, like you have the flu, with symptoms such as fever, sore throat, and muscle aches. The rash and other symptoms may come and go over time. Then, the latent stage, the infection is hidden. There are no visible symptoms during this stage, but the bacteria remain in the body. This stage can last for years, and without treatment, the infection can progress to the final stage. Finally, the tertiary stage, serious health problems arise. These complications can affect the heart, brain, and other organs, leading to severe health issues such as neurological disorders, cardiovascular problems, and even death if left untreated. It's crucial to remember that syphilis can be cured with the right treatment. Early detection and prompt medical intervention are key to preventing long-term complications. Treatment is most effective in the early stages, so regular checkups and being aware of the symptoms can make a significant difference in managing and curing syphilis. Hair loss and syphilis. A telltale sign in the secondary stage. Hair loss is a possible symptom of syphilis. It usually happens in the secondary stage. This stage occurs a few weeks after the chancre heals. The hair loss is often patchy. You might notice thinning hair on your scalp. Some people lose hair in clumps. It can also affect eyebrows, eyelashes, and body hair. The good news is that hair loss from syphilis is usually temporary. With proper treatment, hair often grows back. If you notice unusual hair loss, don't panic. See a doctor. They can determine the cause and recommend the best course of action. Syphilis by the numbers. Prevalence and impact. Syphilis is a global health concern. Millions of new cases occur worldwide each year. In recent years, there's been a resurgence of syphilis in many countries. This highlights the importance of awareness and prevention. According to the World Health Organization, or WHO, an estimated 6.3 million new cases of syphilis occur annually in adults. Untreated syphilis contributes to over 200,000 stillbirths and infant deaths each year. These figures underscore the serious nature of syphilis. It's vital to take steps to protect yourself and your partners. Section 5. Treponema pallidum, the culprit behind syphilis. Syphilis is caused by a tiny organism called Treponema pallidum. It's a type of bacteria known as a spirochete. This spiral-shaped bacterium infects humans. It spreads through direct contact with a syphilis sore. Treponema pallidum is a fragile organism. It can't survive long outside the human body. This means transmission primarily occurs through sexual contact. Understanding the nature of this bacterium emphasizes the importance of safe sex practices. Section 6. Real-life stories, syphilis and hair loss experiences. Many individuals have faced the challenges of syphilis. This infection, caused by the bacterium Treponema pallidum, can have a wide range of symptoms, including hair loss. It's a condition that can affect anyone, regardless of age, gender, or background. Their stories shed light on the impact of this infection. By sharing their experiences, they help others understand the importance of early detection and treatment. These narratives also highlight the emotional and psychological toll that syphilis can take on individuals. Take, for example, Sarah, a young woman who experienced hair loss as a symptom of secondary syphilis. Her journey began with a few strands of hair falling out, which she initially dismissed as stress-related. She initially dismissed it as stress. However, as the hair loss continued and other symptoms began to manifest, such as skin rashes and fatigue, Sarah realized something more serious was happening. But when other symptoms appeared, she sought medical help. After a series of tests, she was diagnosed with secondary syphilis. The diagnosis was a shock, but it also provided a path forward for treatment and recovery. Sarah's story highlights the importance of recognizing symptoms and seeking timely treatment. With the right medical care, she was able to manage her symptoms and eventually recover. Her experience underscores the need for awareness and education about syphilis. Another example is John, who experienced hair loss during his battle with syphilis. For John, the hair loss was not just a physical symptom but also a source of deep emotional distress. He felt embarrassed and isolated. The stigma associated with syphilis made it difficult for him to talk about his condition, even with close friends and family. This isolation only added to his emotional burden. John's story emphasizes the emotional toll this infection can take. Remember, you're not alone. Reaching out for support can make a significant difference. Friends, family, and support groups can provide the emotional backing needed to navigate this challenging time. Many resources and support systems are available. From medical professionals to community organizations, there are numerous avenues for help. By seeking support and sharing experiences, individuals can find strength and hope in their journey towards recovery. Section 7. Combating syphilis, effective treatment options. The good news is that syphilis is curable with appropriate treatment. The most common treatment is penicillin. This antibiotic is highly effective against Treponema pallidum. The dosage and duration of treatment depend on the stage of the infection. Early detection is crucial. Treatment is most effective in the primary and secondary stages. If you suspect you may have syphilis, see a doctor immediately. They can perform a simple blood test to diagnose the infection. With prompt treatment, you can recover from syphilis and prevent long-term health complications. Section 8. Early detection is key. Regular checkups and testing. Early detection is crucial in managing syphilis. Regular medical checkups are essential. Talk to your healthcare provider about STI testing. They can advise you on the appropriate testing frequency based on your risk factors. Testing is simple and confidential. It usually involves a blood test. Some clinics offer rapid testing, which provides results within minutes. By being proactive about your sexual health, you can detect syphilis early and access timely treatment. Section 9. Prevention and protection, safeguarding your health. Preventing syphilis is vital to protect yourself and your partners. Here are some effective preventive measures. Practice abstinence. The most reliable way to prevent syphilis and other STIs is to abstain from sexual activity. Be monogamous. Being in a long-term, mutually monogamous relationship with an uninfected partner is another effective prevention strategy. Use condoms consistently. Condoms, when used correctly and consistently, provide a barrier against the transmission of syphilis and other STIs during sexual activity. Remember, knowledge is power. By understanding syphilis, practicing safe sex, and seeking regular medical care, you can protect your health and well-being.